And as you all know, OET speaking is for a total of 20 minutes. You start with a warm-up, and in the warm-up, you will be asked about 5 to 6 questions. Here, you are not marked. There is no mark for warm-up. But still, you have to perform very beautifully and very confidently, because if you fail to perform for the warm-up, you will not have the energy to move forward, because that will make you very dull. So it is very important that you prepare the few questions for the warm-up. And that is also in our video. Please, students who have not attended my warm-up, please look into the video. What is the criteria of score? You are marked on your language skills. Language skills is your ability to speak fluently, to use the right tone. Tone. What do you mean by tone? It should be like an ECG. There should be a voice modulation. Should not say in the same tone, because that sounds very monotonous. But for example, I'll give you an example. When you close the dialogue, don't say thank you, but instead use a high pitch and say thank you. Or when you begin a conversation, good morning, don't say good morning. Did you all understand? See, all that,
Yes.
you all think that will not make a difference, but that will really make a difference, because first of all, your voice is being recorded, and that is sent for evaluation, isn't it? So that everything is in the voice. So you have to create a voice modulation. That is important. Don't speak too fast. The problem is, if you talk too fast, you will end up fast. You don't have anything much to say. And number two, again, there are some areas where you're not clear on, where you have a doubt. When your speed reduce, again, there'll be a big difference between the two pace of speaking. Did you all understand? So what happens is there's a big difference between your pace. So it is always safe to talk at a moderate pace. Don't be too fast. Don't be too slow. Did you understand?
Yes.
Yeah, I see. I'm talking with the practical point of view, not based on theory. And clinical skills. What does clinical skills refers to? It is your ability to listen patiently to whatever the patient says, and don't be judgmental. For example, if they say they are addicted to alcohol, that is, they consume about 40 cigarettes per day. Don't say, oh, just say, don't be judgmental. Instead, say, okay, well, we shall do the needful. That should be your approach. Don't be judgmental. And then after every question, when you get the information, when you want to get information from the patient, can I have that? Can you tell me? Should be very polite. And once the patient gives a lot of information, don't rush to the task. Instead, say, thank you for your valid information. Please write it down. Valid, important information. And then go on to the task. And most importantly, see, when you begin the dialogue, when the patient tells you some problem of their own, don't be in a hurry to come to the task. Instead, what do you say? Give a reassurance. Don't worry. We are here to give you the right treatment. See, usually the settings are mainly for two things. Some people come for guidance to the clinic regarding vaccination or regarding pre-op. So in such cases, you can say, don't worry, we are here to give you the right guidance. Do you understand?
Yes.
Yes, ma'am.
But if it's for a hospital setting, like an emergency department, don't worry, we shall give you the right treatment and you are at the right place. You all understand?
Yes, ma'am.
Yeah. Then how to initiate a conversation. I'll just tell you something in general. What is a known case? A known case is if the patient and the health professional knows each other before. Yes or no?
Yes, ma'am.
Yeah. What are the examples of such known cases? Tell me, y'all tell me.
Hospital ward.
Hospital ward, when the patient is being admitted, you're familiar with the patient. Yes, good.
Rehabilitation unit.
Sorry? Which unit?
Rehab.
Okay, rehabilitation unit. Then?
Frequent home
visit.
Home visit, when it is on a multiple visit, not the first visitor. The home visit is the first visit, they don't know each other. Multiple visit, which means you are continuously going. That is fine. Then what else, Jacinta, what did you say? GP.
Frequent home visits. Yeah.
What about GP? Is a known case?
Frequent visits GP.
Yeah, that is also a known case. See, in the case of, if it's a known case, what do you do? During the preparation time, See, for the exam, before the role play, you are given 3 minutes for preparation. What is it that you do first? When you get the question paper, what do? You usually take a pencil, note down, underline the main points. And once you are settled, look at the face of the examiner and ask, how can I address you during the role play? This is a must if it's a known case. If it's an unknown case, it is optional. If you want, you can ask. Is so much clear with you?
Yes,
Yes,
ma'am.
ma'am.
Yeah. So if it's a known case, you ask the patient, "Well, how can I address you during the role play?" For example, if I say, I am Deepa, if it is a known case, call me by my name when you begin the conversation because you already know me, isn't it?
Yes.
Well, Miss Deepa, and then you can continue the dialogue. If it is an unknown case, what do? I told you it is optional. If you want, listener, if you want, you can ask during the preparation time, how can I address you during the role play? And suppose if the examiner says, Deepa, you don't know the patient in advance, isn't it? So before, if it's an unknown case, before starting the dialogue, you can again ask, can you restate your name? Please write it down for those of you who does not know it. Can you restate your name for the record, please? Then I'll again repeat and say, I'm Deepa. Okay? Now, this is a case. This is a single case. Suppose if it is a parent and a child, what do? Parent and a child, if it is an unknown case, what do? And the child is a patient, but the child is not present. Child may be present, may not be present, but that is not relevant because if the child is very small, it is the parent, either the mother or the father, who will be actively involved in the conversation, isn't it? So there are different ways of approaching it, but still, to be on the safe side, I would say, again, you can ask. If it is an unknown case, you can ask during the preparation time. If the child is a patient, you can say, how can I address the child or the patient during the role play? Then suppose if they say Anne, but this child is not there, child may be there, may not be there, but it's a mother. Assume that the mother is there in the scene. How do you say? You can say, if it's an unknown case, you can restate. Can you restate the patient's name? Then I'll say, once again, I'll say it is Anne. Then you can start the dialogue by saying, am I talking to Anne's mom? Am I talking to Anne's mother? And then you start off with the dialogue. Okay. So this is how these are the very practical ways how we all should initiate the conversation. Then explanation. Yeah. How do you introduce yourself? Introduction is always a must. How do you say, good afternoon, I am Asinta, one of the nurses in this department. Or I am Asinta, who will be attending you today. If it is a clinic, you can say, welcome to our practice. Please write it down if you think it is useful. Welcome to our practice. That is how you can introduce yourself. Okay. But there are some cases where you don't need an introduction. This is very important. Now, please listen. When is it? Suppose sometimes in the background, you will be given a statement like this. A patient has come to the clinic for dressing of the wound. And the second line will be, you have completed the dressing. Okay. And you're giving advice regarding the care to be taken at home. When you get a sentence like, you have completed the dressing, do you think you can say, how can I help you? And can you begin like that?
No, ma'am.
No.
So instead, how do you say? You must ask the patient. Yeah, you must ask the patient the name. There is a preparation. Okay. For example, how can I address you during the role play? If they say it is Anu, well, Miss Anu, I have just completed your dressing. And now I shall give you some of the guidelines regarding the care. Don't you think we should say like that?
Yes, ma'am.
Yeah, very, very important. Huh? Every time, don't go and hit and say, how can I help you? That doesn't suit. Another thing I want to tell you is, suppose in the first task, find out the reason for your visit. How do you all say?
Can you tell me the reason that brought you here?
Yeah. Or can you tell me the reason behind your visit? Or how can I help you is fine, isn't it?
Yes.
Suppose if the first task is confirm the reason for visit, bracket vaccination. How do you all say? Confirm the reason for visit. Bracket PPV vaccination. How do you say?
Well, I have your notes with me here. Is it that
Can I
you
confirm?
let me confirm that you are here for so and so vaccine?
Yeah. Can I confirm that you have come for your PPP vaccination? Did you all understand, students?
Yes, ma'am.
So, yeah, these are the
Yes, sir.
common things that will come now. These are seen for the exams nowadays. Are you all with me? I don't get much of a response. So, see, I'm not going to read any notes. I'm going to talk from my experience and what I feel is important. Okay. Task. When the task begins with verbs like find out, ask, the easy thing is, can you please tell me? I would like to know. Please take two things which you find is easy and comfortable for you. Can I? Suppose if you have come to take the vital signs, can I have your consent for assessment for taking the vital signs? Always be polite. And once you have done the procedure or once you get the permission, say thank you. If it's an information, you have to say thank you so much for your valid information. Clear?
Okay, ma'am.
Checking understanding. Yeah, if you want to know about their medications or if you want to know about their say lifestyle and the habits, I would like to check whether you have been smoking regularly. I would like to check whether you have been consuming alcohol. Or can you tell me about your regular medication usage? When you get the information from the patient, now you have to give back the information, isn't it?
Yes,
So
ma'am.
it is one good way of saying is, now that you have told me about your details, I would like to suggest some measures. Or you can say, now that you have, suppose, imagine if it's a smoking cessation setting. Suppose if the nurse asks you about your smoking habits, and then the nurse wants to give you some measures as to how you can stop that habit. Then how do you say, example, now that you have told me about your smoking habits, I would like to suggest some measures that will help you to quit smoking. Or I would like to recommend some measures that will help to quit smoking. Did you understand?
Yes, ma'am.
Yes, ma'am.
Yeah. Change the patient's mind. We have seen in a lot of role plays, isn't it? Where sometimes the patient is not cooperative, reluctant. What is the meaning of reluctant?
Not willing.
Not cooperative.
cooperate.
Not cooperating.
Yeah. So it is a big task because you have to convince the patient. You have to understand them, give them the importance. For example, suppose if a patient is admitted, he is in a bad shape, but he wants to go home because it's a very uncomfortable setting in the hospital. In such cases, you have to say, well, I understand it must be difficult for you to continue in this hospital, but it is critical that it is important that you continue the treatment in the hospital. Otherwise, there are certain risks. So when you see in the task, when you see verbs like persuade, മലയാളത്തിൽ നിർബന്ധിക്കണം, emphasize, give importance, അതിന്റെ ആവശ്യകതയെ കുറിച്ച് പറഞ്ഞു മനസ്സിലാക്കാനുള്ള stress, same meaning, reinforce, make the patient understand, promote, make them understand, express concern. അതായത് ഇങ്ങനെ പോയാൽ ശരിയാകത്തില്ല കേട്ടോ, so it is better you stay in the hospital. ആ രീതിയിലുള്ള ഒരു മെസ്സേജാണ്. Convince, you have to give importance and say it is so important. Okay. Pinne, reassurance. This is something that is very, very important and that gives you a lot of marks. When does the reassurance begin? I would say it begins after the first task. When? I will tell you exactly. Suppose if you are the person as a nurse who should start the introduction, isn't it? Suppose if say the first task is confirm the reason for patient's visit, bracket if it's PPV vaccination. So how do I begin? Well, can I confirm that you have come for your PPV vaccination? Then my answer as an examiner will be, yes, definitely. I've got a letter from the clinic saying that I need a PPV vaccination, but I don't know whether I should have or not. it is then that the reassurance begins. You have to say, definitely don't worry, we shall give you the right guidance. Only after saying that should you look at the task number 2. Did you all understand, students?
Yes, ma'am.
What for my personal students also, what I see is, അവർക്ക് ഇത് ധൃതിയാണ് ടാസ്കിലോട്ട് ഓടാൻ അവർക്ക് ധൃതി. They are so much in a hurry to attend the task rather than going step by step. Because all these gives you a lot of marks. So you have to be very matured in your talking. Go slow. Think wise. Okay? So what are the other phrases which you can use for reassurance? Don't worry, we are here to help you. We shall give you the right guidance. Don't be overly concerned. Are you getting me? These are fillers. Instead of, in order to avoid the gap, you can say, are you getting me? Are you following me? Please write it down. I hope you understand. Is there any clarification? See, these are things that you can use in between as fillers. Karna, you can avoid a big gap in between. Clear?
Yes,
Ma'am.
ma'am.
See, today I'm not talking on the basis of screen, not talking on the basis of notes. I'm talking from my own experience. I thought after teaching y'all, I thought these advice would be useful. Task. Yeah. Task. Nowadays, we see that the earlier small task, small role plays was the norm. Now it has changed. Today, we have long tasks, and each task will have multiple questions. For example, give information about dash. Full stop. Advise the patient regarding dash. Full stop. Find out, explore any recent incidents. So everything will be given in one task. So how do you address them? Don't say everything together. Address them one by one. Okay. Give information. How do you begin? Well, I shall explain regarding the preoperative measures. Advice. Let me advise you regarding the post-operative measures. Find out. And I know if you had any incidences related to this. Remember to deal with the task one by one. Did you all get me? Task background. Yeah, this is, I'm not explaining this. This is just a role play situation. But I think straight away we'll go to the role play card. Can everyone see this? I want one person to read just the background and the starting. Can one of you read?
General practice. You are preparing a 25-year-old apprentice for excision of a pylenoidal sinus in bracket cyst next week. The patient is in pain but is embarrassed about the problem and thinks taking medication to alleviate pain is a sign of weakness. Discussing treatment and preoperative documents following the doctor's appointment.
Okay. See, it's a general practice, which means it is consultation with the GP. And you are the nurse in that department. Okay, so much clear? You are preparing.
Yes.
You as a nurse is preparing. Who? A 25-year-old apprentice. Apprentice meaning someone who takes up a training, a job under another. That is enough. You don't have to understand more about that. So you're preparing a 25-year-old apprentice for excision, meaning removal of a pylenoidal sinus cyst next week, which means this procedure is scheduled for next week. Yes or no?
Yes.
It's scheduled. You can use all this in your speaking. The patient is in pain. Patient is nalla vedanayundu, but is embarrassed. Embarrassed. Can everyone pronounce that with me? Parayavo.
Embarrassed.
Embarrassed, because I found that some of you didn't even know the meaning of this. I wonder they got stuck. Embarrassed meaning and shy. Okay, shy. If you don't understand the meaning, if you find it difficult to pronounce, you can say shy or difficult. The patient is in pain but is embarrassed about the problem because of the cyst and things. taking medication to alleviate pain, to reduce pain is a sign of weakness. I want you to tell me what does weakness here means. ഒന്ന് പറയാമോ? Is it physical weakness they are referring to? And what else?
മെഡിസിൻ എടുക്കുന്നതിന്റെ
എടുത്താൽ അതൊരു എനിക്ക് നാണക്കേടാവോ?
You feeling one, you think that only people who are vulnerable takes medicine. അത് അത്ര ആവശ്യക്കാരായിരിക്കും, എനിക്ക് അതിന്റെ ആവശ്യമില്ല, ആ രീതിയിലുള്ള ഒരു ചിന്തിക്കുന്ന വ്യക്തികളില്ലേ. You think they are vulnerable if you take medicines.
Healthy
അല്ലെന്ന് തന്നെയല്ല, some they find it's kind of weakness. അവർക്കൊരു കുറച്ചിൽ പോലെയത്, അല്ലാതെ എനിക്ക് അഡ്ജസ്റ്റ് ചെയ്യാന്നുള്ളത്. There are some people like that, no? Yeah. So the patient is in pain but is embarrassed about the problem and think taking medication to alleviate pain is a sign of weakness, meaning being vulnerable. Did you understand this meaning? Because only if you understand this meaning can you go ahead. Ellarkum manasilayo?
Yes.
Yeah. Now, what are you doing? You are, see, the last line is very important. You are discussing treatment and preoperative documents. So as a nurse, you have come to discuss what? Treatment and preoperative documents. See, all these are important because you can start the dialogue by using all these. Following doctor's appointment. Following doctor's appointment, which means after seeing the doctor, this patient has come to you for discussing the treatment and preoperative documents. Is so much clear with you all?
Yes, ma'am.
Yeah, the nurse is preparing for the procedure, in short. Clear, everyone? Now, can another person see? Are the rest with me?
Yes, ma'am.
Yes, ma'am.
Yeah. Now, one person, please read the first task for me.
Express the concern that the patient has pain and views taking analgesic as a weakness.
Express concern. Meaning you are doubting. അതായത് എനിക്ക് തോന്നുന്നു, മലയാളത്തിൽ പറയാം, എനിക്ക് തോന്നുവാ, നിങ്ങൾക്ക് അങ്ങനെ തോന്നുന്നുണ്ടോ, ആ രീതിയിൽ പറയത്തില്ലേ. So express concern, that which means that there's a doubt that the patient has pain. Did you see an and in between? And views
Yes,
taking analgesics synonym. You can use painkillers also as a sign of weakness. And views taking analgesic as a weakness. And you as a nurse think that he doesn't like taking analgesics or painkillers because you think that they would think that it's very vulnerable taking that. അവർക്കൊരു കുറവ് പോലെയാ, ഒരു മോശം പോലെയാ. So this is what you need to address. You cannot straight away ask, do you think taking analysis is a weakness for you? That is not proper to ask this way, isn't it? So how can you ask in a very refined way? എങ്ങനെ ചോദിക്കും? If you want, you can ask both these together, അല്ലെങ്കിൽ ഓരോന്ന് സ്പ്ലിറ്റ് ചെയ്ത് ചോദിക്കാം. Okay. So express concern that the patient has pain and views. View എന്ന് പറഞ്ഞാൽ നിങ്ങളുടെ കാഴ്ചപ്പാടില് നിങ്ങൾ കാണുകയാണ് taking analytics as a weakness. So how do you, I forgot, how do you open the setting? How do you begin the conversation? GP, so you can ask during the preparation time, you can ask, how can I address you during the role play? Isn't it? Then the patient will say one name, for example, Anu. Then you can say, good afternoon. Then you can tell your name. I am Diana, one of the registered nurses in this department, who will be attending you today. Then you can straight away say the background, okay? Should begin, this conversation. Well, I will be discussing, look at the last line of the background. Well, I will be discussing regarding the treatment and pre-operative documents as you have been scheduled for an excision next week. Did everyone get it?
Yes, ma'am.
See, this is how you have to begin. Use the information from the background. Well, I'm here to discuss regarding the treatment and pre-operative documents. Please, കഴിവതും task തന്നെ വായിക്കാൻ പഠിക്കുക. Then add extra information when necessary. That is easy because that looks very formal. I am here to discuss regarding the treatment and pre-operative documents. As you know, you have been scheduled for the excision next week. Okay, so this is how you open. Then first task, how do you address? This is one option. Am I right in thinking that you are going through a lot of pain? Am I right in thinking that you are going through a lot of pain? Appended answer on that. My answer will be yes. I feel very weak because of this ailment. Ailment is I feel weak. Okay, then ask the next part. Are you reluctant to take painkillers? Or am I right in thinking that you are reluctant to take painkillers? Painkillers. Then my answer is no. I think I need painkillers more often than I usually take them. Okay. Did everyone understand this first part?
Yes, ma'am.
Yeah, this is very tricky. No one got it. Okay, now come to the next task. Read. Someone else read it for me.
Assure the patient that you understand the embarrassment, but doctors and the nurses are used to a huge range of medical issues.
Yeah. Assure the patient. You have to give them confidence that you understand it is embarrassing. But in the hospital, we doctors and nurses and doctors we are used to, we are familiar. Are used to meaning familiar. We are familiar to a huge range of medical issues. That is how you reassure them. Okay. Then how do you say that? Well, I understand that this situation can be embarrassing. Embarrassing I can understand that this situation can be embarrassing. But we nurses and doctors, nurses and doctors in this hospital, are used to, are used to a huge range of medical issues. Don't stop there. You add an extra explanation. So there is nothing to be worried about. So please don't worry. Everyone, is it clear for everyone?
Yes, ma'am.
Clear?
Yes, ma'am.
Yeah. Then what is my answer? I'm using a little bit of Malayalam, okay? Yes, definitely. I know it is quite embarrassing. Because of that, when the doctor told me about this pilonidal sinus, I couldn't even pay attention to that because I was quite embarrassed. So I could not pay attention to that. Then I'm asking, can I know something more about what this pilonidal sinus is? Can you explain me more about this? Then read the third task. Fast.
Explain that a pylonoidal sinus is a small opening, a tract on the surface of the skin predominantly caused by an ingrown hair, exacerbated by sweat and prolonged sitting.
You have to, you're explaining what a pilonidal sinus is. Okay, it's a small opening. Predominantly, what does that meaning? Mainly. Pradhanamayum and a karana. Mainly. Exacerbated. Aggravated. Another word for that. Aggravated. Kudalum and a karana. Aggravated. Kudan karana in Malayalam. Prolonged sitting. Continuous sitting for a long period of time. Did you understand the meaning of it now?
Yes.
Yeah. So how do you say this? You're explaining what it is. Definitely. My question is, can I know more about this? What exactly is this? Because I could not even pay attention to the doctor. Then you have to say, well, definitely, I shall explain what it is. Don't use the term pilonidal sinus throughout. Karna, this is a lay person. They don't know anything about this. So it is enough if you say, well, definitely I shall explain what it is. Okay, then you can say pilonidal sinus is a small opening. See, look at the task. Try to say some of the task that is more formal. Pilonidal sinus is a small opening, a tract on the surface of your skin, mainly, predominantly, I used another word, mainly caused by an ingrown hair, which is aggravated by sweat and prolonged sitting, which is mainly caused by sweat and long hours of sitting. Long hours of sitting. Are you getting me? Then I'll say, I will, I will get very angry. Then I'll say, please, I am a very clean person. And because of my work, I take shower both in the morning and have bath at night. മലയാളത്തിൽ പറഞ്ഞോട്ടെ. ആള് പറയും, പിന്നെ ഞാൻ ഭയങ്കര വൃത്തിയുള്ള ആളാ, ഞാൻ 2 നേരം കുളിക്കുന്ന ആളാ, എനിക്ക് ഇങ്ങനെയൊന്നും വരത്തില്ലെന്ന് പറയും. Okay, he tries to defend himself, saying that, this does not apply to me because basically I'm a very clean person. Okay, then you read the next task. Vaiche.
Reassure the patient that you are not indicating that she or he is dirty, and next, not clear.
Salt bath.
Salt
bath.
Baths post-operatively will help facilitate healing.
Okay, thank you. Reassure the patient. You have to give confidence that you are not indicating. You are not indicating. You indicate past tense that he or she is dirty. Dirty. That is what you have to say. Okay. And the next is a totally different aspect. There is no connection between two. And salt baths after the procedure will help in healing. So you have to take it both differently and say differently. Okay. Take it by one. Then how do you reassure the patient? Well, please don't misunderstand. Please don't misunderstand me. ഞാൻ ഉദ്ദേശിച്ചത് നിങ്ങൾ dirty ആണെന്നല്ല കേട്ടോ. മലയാളം. I was not indicating that you are not maintaining personal hygiene. I was not indicating that you are dirty. No, dirty. I was not indicating that you are not maintaining personal hygiene. പക്ഷേ കൂടുതലും ഇത് സ്വെറ്റും prolonged sitting കൊണ്ടാണ് ഇത് സംഭവിക്കാറ്. You must also give that explanation. But it is generally exacerbated by sweat and prolonged sitting. I'll repeat it once again. Well, please don't misunderstand me. I was not indicating that you are not maintaining personal hygiene, but this is generally exacerbated by sweat and prolonged sitting. See how I added an extra information to make it more explanatory. Did you all understand?
Yes, ma'am.
So it is not enough if you say the task alone. Chalapam, you have to add and make it more explanatory. And then let me attend the second task. Salt baths post-operatively will facilitate healing. If you want, you can rephrase, you can rearrange and say, let me also remind you, let me also remind you, post-operatively, I'm going to rephrase that. After the surgery, it is advisable to take salt baths Karanam, as it will help in the healing process. അത് കഴിഞ്ഞൊരു ഫീലിംഗ് ആയിട്ട് നമുക്ക് പറയാം I hope you understand, so that there is no gap in between. Hello?
Yes, ma'am.
Yeah. Let me also remind you, after the surgery, it is advisable to take salt bath, as it will help it with the healing process or in the healing process. I hope you understand, or are you following me? Clear?
Yes, ma'am.
Yes, ma'am.
Then my doubt is there anything I need to do after the procedure? The procedure കഴിഞ്ഞിട്ട് ഞാൻ എന്തെങ്കിലും ചെയ്യേണ്ടതായിട്ടുണ്ടോ? Read the next task, last task.
Provide information on post-operative care, example bleeding, signs of infection, importance of taking analgesia appropriately, use of antiseptic dressings, etc.
Please, for heaven's sake, don't use etc. an example. But either in the place of extra, if you want, you can etc. If you want, you can add more information, but don't use etc. Okay. So what my question is there anything I should do after the surgery? Then your answer is you have to give information about post-operative care and the bleeding, signs of infection, importance of taking analgesia appropriately. That's a different task. Use of antiseptic dressing. So these are three different things we have to address. Okay, let's see how we go about. See, remember, earlier did I mention salt bath? Yes or no? I mentioned
ma'am.
salt bath, isn't it? And that when should it be done? It is after the surgery again.
Post-operative.
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 So again, actually, you can add that also. But if you want, you can say along with the salt bath. Even if you have repeated earlier, you can mention again because it comes after the surgery, isn't it? Along with
Yes,
the
ma'am.
salt bath. അതായത് നേരത്തെ പറഞ്ഞിട്ടുണ്ടായിരുന്നു അപ്പൊ ഒന്നുകൂടെ ഓർപ്പിക്കുക സോൾട്ട് ബാത്തിനോടൊപ്പം along with the salt baths, comma, please watch out. ശ്രദ്ധിക്കണേ, watch out for signs of bleeding and signs of infection, as if you want, you can quote two examples, as increased pain or rise in temperature. Next task. It is also important to take painkillers appropriately. Why? To ease your pain or to reduce your pain. Give an extra explanation. Okay, we have to wind up. Lastly, it is good if you use like that. Lastly, it is also important to use the antiseptic dressing over the wound site. Lastly, it is also important to use the antiseptic dressing over the wound site. Are you following me? Did everyone understand?
Yes, ma'am.
Understand, ma'am.
Then my answer is definitely. I will follow your advice when I am in the hospital, and I will follow the medication regime when I go home. It is better than suffering pain. Definitely, I'll do that. So, how do you wind up? You can say, it is good to hear that. Don't keep quiet. It is good to hear that. Or you can say, thank you so much for your cooperation. You can either use one, don't use both. Okay? And then you wind up. You just see, winding up is also very important as opening, because that gives you a lot of marks. How do you wind up you beautifully? Can I ask this? Apart from these,
Do you have any
Thank
other
you for
concern?
listening. Have a great
Yeah.
day. Have a speedy recovery.
Do I need to explain
Yeah.
anything else?
Yes, all that is fine. But apart from these, do you have any other concern? Or I hope I have addressed all your concerns. Then you can say, Then the examiner will say, thank you for information. Everything is clear now. Then how do you say? Thank you. Please make it a point to raise your tone and say, thank you. Don't say, thank you. Did you all understand?
Yes, ma'am.
Yes.
I don't hear much of a response. Did everyone understand this?
Yes,
Ma'am,
ma'am.
can you explain last bullet point once again?
Which one?
Last bullet point, provide information on post-operative care.
You can say, along with salt baths, please watch out. Please look out for signs of bleeding and signs of infection, like or as increased pain or rise in temperature. It is also important to take analgesics or painkillers. You don't have to say both, just say one. Appropriately to reduce your pain. Lastly, it is also important to use the antiseptic dressing over the wound site. Clear? Now we're going to have a replay. Replay. Okay. I want everyone to start. Everyone to participate. Give chance for everyone. After the first task or after the first half, let the other person continue. So that there is participation. You go wrong, doesn't matter. I'm here to help you. Okay, can you all start? Preparation time, how do you all ask?
How can I address
address
you?
you during the role play?
Well, I am Anu. That is my name. Okay, now begin.
Okay, thank you, Mr. Anu.
Mr.
Mrs.
Miss.
Okay. Okay, tell me. Continue. I was just bullying. Okay, don't take any offense.
Anu Mr. Anu is me.
Anoop. I said Anu. Okay. Say.
Hello, good afternoon.
Good afternoon.
I'm Manu, a registered nurse working in this department here. And I would be assisting you today.
Okay.
Well, let me tell you that I'm here to discuss with you regarding the treatment and pre-operative documents as you have been scheduled for this operation.
Okay. Now, yeah, good. Now next person, can another person continue? Shaibi, thank you.
Well, I'm right in thinking that you are going through a lot of pain, and you are reluctant to take the painkillers.
Am I right? Okay, definitely. I feel I am weak because of this ailment, but I think I need to have more painkillers than I usually take. Other person.
I'm so sorry to hear that, Miss Anu. Don't worry. Right now, you are here in the safest place. We all are here to help you out from this situation, this condition.
Attempt the next task.
I can understand that you are embarrassed about this, but we nurses and doctors are seeing these type of cases in wide range.
Okay.
Are you?
Please don't.
So please don't worry.
Okay. Yeah, actually, I am very embarrassed. Therefore, I could not even pay attention to the doctor when she was explaining what a pilonidal sinus is. So, can I have more information on that? Can you tell me more on that?
Well, definitely. I shall explain what is pilonidal sinus is a small opening tract on the surface of the skin, predominantly caused by an ingrown hair exacerbated by sweat and prolonged.
Okay. But I don't agree with you because I am basically a very clean person. And because of my work, I take a shower in the morning as well as have a bath at night. So I don't think I can get this infection.
Well,
Adala.
please don't,
Continue.
please don't misunderstand me. I was not indicating that you are not maintaining your personal hygiene, but it is generally exacerbated by sweat and prolonged sitting.
So sitting. Okay.
Am I
Okay.
clear to you?
Yeah, am I clear to you? That is also good. Now, do you think, is there anything that I should do after the procedure? Next person.
Yeah,
Next person.
let me remind you that it's important to take salt bath post-operatively. It will help to facilitate your healing.
Okay, I
Fast.
forgot. It is after that I should ask. Now, is there anything I need to do after the surgery? Next person.
Along with the salt bath, please watch the signs of complication like bleeding, infection,
Okay.
and also maybe fever.
വേണമെങ്കിൽ അടുത്ത ആൾക്ക് പറയാം. Someone else can join.
It is also important to take your medications regularly, like painkillers on appropriate time. And lastly, to use antiseptic dressings.
Over the wound site. Okay, make it more
Okay,
explanatory.
ma'am.
Okay, ma'am.
And how do you end it? Parnyo?
I hope I have clear all your doubts.
Then I'll say, definitely, I will follow your nurse, the nurse advice you've given me when in the hospital, and I will also follow the medication regime once I go back, rather than suffer pain.
It is
Okay.
good to hear
Well,
that.
well,
Is there any
I'm
further
really glad
concerns
to hear
or any
that.
questions?
Yeah. Well, I'm really glad to hear that. It is good to hear
It
that.
is
All
good
that
to
is fine. Okay, now how do you wind up? Parnyo?
I
Apart
hope
from
I
this-
addressed all your concern. Thank you.
Yeah, someone else told me, asked me, apart from these, who said that? Can you all repeat that? Can one person repeat that?
Apart from this, do you have any further concerns or queries?
No, actually, you have given me a very good idea. Thank you so much for your information. Thank you.